HCD TV from the publishers of Healthcare Design, providing expert insight into the design, architecture, and engineering of healthcare environments. Online, in print, and in person. HCD TV.
This is Dan Timoney. We're here at the Healthcare Design Conference 2011. I am talking with George Mann, Professor of Architecture and member of the Healthcare Design Editorial Advisory Board.
I'm Professor of Architecture. I hold the Skaggs Sprague Endowed Chair in Health Facilities Design at Texas A&M University. We have a very unique program which I helped found in 1966, over 45 years ago. And our unique program addresses the issues of design, planning, and construction and operation of health facilities.
So, George, can you tell me a little bit about what you've been hearing at the conference, the big topics, things that healthcare professionals will be able to bring home and work into their everyday workflow?
What I'm hearing is a lot of good ideas about the future of healthcare. We are living in a tight economy. Adaptive reuse, sustainability, energy conservation, green architecture, healing environments. I'm hearing about international program. I just got back from China. China has 20,000 hospitals and 1.3 billion people. I'm hearing about the future as being international in scope, and American firms are out there on the front line doing all kinds of projects all over the world.
There's a lot of changes happening, government policy, new technologies, the aging population. Where do you see healthcare design in 3, 5, 7 years?
I think we're going to have a more balanced system. Up until now, our system has been very curatively oriented. We need a system that goes further in the community in terms of prevention and early diagnosis and treatment of disease. Surely we all have had people and families who discovered they were ill with heart disease or cancer that may have been nipped in the bud earlier on if we had a different kind of a system. Not only do we need primary care facilities, we need primary care doctors.
So, also dealing with the future of healthcare design, you help run the Student Charrette, which is the competition, the architectural design competition, and you are also a professor. Can you tell us a little bit about the up-and-coming generation of healthcare design professionals and what we can expect from them, maybe?
Well, I'll be glad to. I would like to add that I'm the Skaggs Sprague Endowed Chair in Health Facilities Design. Ron Skaggs was in my first class at Texas A&M, and Joe Sprague was in my fourth. And they got together and endowed a chair, which enabled me to bring students to meetings like this. In addition, Vendome very kindly waived the registration fee for 14 of our students. 5 other students were participating in the Design Charrette sponsored by STIRIS. So there were 4 schools involved. There was Texas A&M University, Texas Tech, the University of Kansas, and the University of Illinois. And they did some wonderful things in wellness centers related to sports facilities. Our unique program looks at the future. We explore, we've done Flying Eye Hospital and a DC-10. We've done a hospital ship. We've done cancer centers, stroke centers, facilities for the elderly. Flew the class to Chicago to do Chicago Children's Hospital in the 90s. And then a few years back, we did the Hebrew Home for the Aged in Boston. We flew the class up there. So we're very practically oriented, hands-on, doing projects every semester. This last semester, we did an eye hospital, as I mentioned, for Puyang, China. And last year, we did a rehab center in the Sudan. And prior to that, we did a rural hospital in Tanzania. Our students went over to Tanzania. So there's a lot that needs to be done. We're standing at just 7 billion people now. By the time the kids get to be my age, there'll be 10 billion people. We're not taking care of what we have now, let alone what's coming down the pike. There's a lot to do. We've got a young generation that wants to do it. So we need to get out there and support them, and you have supported them, and I want to thank you and Vendome.
Here's the toughest question of the day. What is your favorite thing about coming to this conference?
Seeing all kinds of people, and the informal conversations are sometimes as valuable as the sessions, and the sessions are very valuable. And there's always something new. And Vendome is an unusual group because you're constantly innovating. And so it's a sum total of everything. Plus, I get to see my former students. Plus, it's a good excuse to be away from my office for several days with the students. Congratulations. Keep up the good work, all of you.
HCD TV, from the publishers of Healthcare Design, providing expert insight into the design, architecture, and engineering of healthcare environments. Online, in print, and in person. HCD TV.